Good afternoon to those of you in the Eastern Time Zone, and good morning to those of you Central, Mountain, and West. Welcome to the Systems for Action National Program Office's Work in Progress webinar series. My name is Anna Goodman-Hoover, and I am privileged to be the co-director of the Systems for Action National Program Office. As you know, Systems for Action is a national program funded by the Robert Wood Johnson Foundation. It's an exciting time for us here at Systems for Action because this month we are rolling out exciting new projects that were funded in response to last year's 2017 call for proposals that was issued middle of last year. We have some really exciting research coming online to help us think about how we can better align the systems and services that support health and well-being across the nation, whether those systems and services be occurring in public health and healthcare or in social services and support. So we're very excited today to share with you some of that new work that is just getting underway. Just to let you know, we are going to have two speakers talking about this new research on strengthening the carrying capacity of local systems. Danielle Varda and Katie Edwards will be joining us, and they will be followed by commentary from Cameron Hodgins and Kinsey Adams. And I'm going to give you a little bit of an introduction to those folks in just one moment. But before I do, I'd like to invite you to notice that chat box in the corner of your screen. As we go through the webinar today and folks raise issues that you have questions about or you would like to be more clear, please by all means type your questions in that chat box, and we will, after the commentary speakers have finished, get to as many of those as we can. We want to make sure that everybody has an opportunity to ask those questions and share information. So I promised you an introduction of our speakers today. We're going to be joined by Dr. Danielle Varda, who is the director of the Center on Network Science and an associate professor in the School of Public Affairs at the University of Colorado, Denver. She was previously at the RAND Corporation, where she worked as an associate policy scientist from 2005 to 2008. Dr. Varda specializes in collaborative governance and network leadership, focusing specifically on public health systems and services research. Her research focuses on evaluating the network structure of interorganizational collaborations, the public, private, and nonprofit sectors, and the subsequent network effects of these recorded interactions. Dr. Varda is the author of the Partner Tool and the Person-Centered Network app, and she has been PI on more than 25 projects with funding ranging from foundation to federal and local initiatives. Dr. Varda is going to be joined today by Ms. Katie Edwards, who is the Executive Director of the Nonprofit Centers Network, a national network of 170 nonprofit shared space centers that encompass over 3,300 nonprofits who locate together for improved impact and greater collaboration and reduced operating costs. Prior to joining NCN, Ms. Edwards received her Master's of Public Administration with an emphasis in nonprofit management from Indiana University. She has researched and participated in shared space sector for 7 years, authoring several practitioner-focused publications. After we hear from Dr. Varda and Ms. Edwards, we'll be joined by Dr. Cameron Hodgins, who is a Sarasota native and graduated from Florida State University with a BS in psychology and in special education, and received both her MA and PhD in lifespan developmental psychology from the University of Alabama at Birmingham. She completed her psychology training at the Civitan Sparks Clinic in Birmingham, specializing in developmental disabilities and sibling relationships. Upon moving back to Sarasota in 2007, Dr. Hodgins became the Vice President of Programs and Services at Easter Seals, Southwest Florida. In October 2014, she joined the Glazer Schoenbaum Human Services Center as their CEO. And we will also be hearing from Kinsey Adamson. Kinsey works as the Operations Assistant for Serve Denton, and she provides overall administrative support for the organization, acts as staff liaison for each nonprofit agency partnering with Serve Denton, and contributes to the general development of major donors. Kinsey grew up in Denton, Texas after graduating with a degree in recreation, park, and tourism sciences from Texas A&M University. As I said, we'll begin with hearing from the team in Colorado, and then we will have the commentary from our two speakers, and then we will get to questions and answers. So please do use that chat box, and with that, I hand the mic over to Dr. Varda.
Hi, all. This is actually Katie Edwards. I'm here in the same office with Danielle Varda, and I thought we would get started and I'd share some of the context around this. I'm really excited to share with you our project that is titled Strengthening the Carrying Capacity of Local Health and Social Services Agencies to Absorb Increased Hospital and Clinical Referrals. We are so very grateful to the support of the Robert Wood Johnson Foundation and the folks over at Systems for Action to make this work happen. It's a really interesting project and has a lot of implications for the community that I serve in the nonprofit shared space sector and for all of the local communities that we are studying here. So I'm going to start off with telling you a little bit of the story of how we came together. The Nonprofit Centers Network is a peer learning community of nonprofits that share physical spaces with one another. There are about 500 mission-driven buildings across the U.S. and Canada that are each home to an average of 12 different nonprofit community-based organizations. And a third of this group is really focused on health and human services and being spaces that we can serve the community. Our community has known for many years that intuitively our work is making a difference, but we've always struggled to measure that difference. We hear anecdotes that community members are better able to utilize referrals to other community partners because they can walk down the hall and meet those people, see those service providers, and really build on the trust that's happening within the space. We are located in downtown Denver, just down the street from the University of Colorado, Denver, and the Center for Network Science, where Dr. Varda works. And she has been really studying the networks in nonprofit organizations with a large emphasis in public health and how those networks are working within systems of health and being informed by new discoveries and research around social determinants of health. So she's been seeing, that in some communities, the referral systems are really strong. And with all of the focus around screening for social determinants of health, there's a lot of referrals that are being made to community-based agencies. Sometimes these connections are working really well, other times not so much. Sometimes it's more of a black hole of who are these community-based agencies, what are they able to provide, and how well are they able to provide it to the patients of the public health system. So we met to kind of compare notes and talk about some of these issues and really came to unpack some of these ideas and realize that these two pieces are really connected. We have a lot of place-based networks that are working on the community-based side, and she's got partners that are trying to understand this from the social determinants of health lens. And so we reached out to our network to see if anyone had kind of the full picture, if they had a strong connection with a public health system. And that's where the team at Serve Denton and the team at the Glasser-Schoenbaum Human Services Center came into the picture. They both volunteered and said, yes, we've been working really closely with our health systems on these problems and seeing how we can serve as a kind of a clearinghouse for referrals, trying to make sure that people, at the end of the day, people are being served better, that they are getting the resources that they need. So once we had these two cases, we knew that there was a project here that we could start to design, and we are really using the lens of community-based participatory research, bringing in the expertise from these local communities, bringing in the systems expertise and the network mapping from an academic perspective. And so we are really building out these methods. Our team at the University of Colorado, Denver is Danielle Varda and her colleague Todd Ely, who's also worked with NCN on other projects before, as well as some research assistants from the Center for Network Science, Becky Hofkes and Melinda Mokazuki. Our academics team is rounded out with Rachel Graham from the University of Kentucky. And then on the practitioner-based side, we have Kinsey Adamson, Pat Smith, and Carly Cuban at Serve Denton, who you'll hear from Kinsey later in this presentation as one of our presenters. And then at Glasser-Schoenbaum, you'll hear from Dr. Cameron Hodgins and Charlene Altenhain. I'm joined in kind of the practitioner-focused research lens by Sarah Lampe at the Trailhead Institute, who brings a wealth of public health research background and is also serving as our fiscal agent for the process. So together, we have met as a research team several times to really help inform the methods, inform this project, and build out the theory and practice as we go forward. So our project is really focused on the question of systems alignment. We're trying to see how we can line up the medical and public health referral system to the system and network of community resources. And the first question that we're really trying to answer here is, how do we understand what the nonprofit sector provides to these changing health systems as we are learning more and more components of evidence-based practice? And conversely, as more hospitals adopt social determinant of health screening systems, what is the impact on the carrying capacity of the nonprofit sector? How is the nonprofit sector able to respond as the dependence on these organizations, these community-based agencies, increases? Within that, we have 4 aims. It can seem kind of straightforward, but there's a lot of research that we are building. There's a lot of tools that we are trying to unpack and understand. The first aim is to really define community resources. What do hospitals mean when they say community resources in this kind of lens of social determinants of health screenings? What does that look like? And Danielle will get into the methods of how we're achieving these aims in a few minutes. Then our second aim is to really map the system that determines nonprofit carrying capacity, the ability of the nonprofit sector in a particular location to respond to changes of demand for their services, and what that whole system looks like. We know that it's all interrelated, and you'll see some diagrams in a second that help explain these ideas, but it's hard to boil down into a streamlined process. Third, we're going to really look at how we can align financing mechanisms with the resources that are out there. How do we use things like community benefit dollars in order to strengthen the nonprofit sector and ultimately meet people's needs in a better way? And finally, we are hoping to develop strategies to prepare and build the carrying capacity of nonprofits to be able to continue to respond to the growing demand. As we're understanding the systems of health and how a person's health is impacted by so many other external factors, we're anticipating that we're only going to see more demand for the work of the nonprofit sector. So this slide really highlights this community-based participatory research approach. From the conception of this process, our community partners have been at the table. They're the ones who have all of the local expertise. They're the ones serving these communities every day. And they have the community connections and have the access to data that we can use and build out, see what's there, see what's missing. The teams at University of Colorado and University of Kentucky will be doing the data collection and data analysis and building out our analytical models, and then we will be working together to interpret the findings, translate those to practice, and make it really accessible to a large number of audiences. In my work with practitioners in the nonprofit sector, there's not a lot of bandwidth for digesting research. The learnings need to be easily accessible and things that they can turn into practice immediately. So I'm excited to see this whole pattern emerge and build it out from there. So to get a little bit more into the problem that we are working to solve, this image is a theoretical construct of what we know about the system that exists and as far as it relates to the idea of the nonprofit carrying capacity of the community. We know that we have hospitals and public health systems that are seeing patients, the people in the middle of the diagram. And we know that those patients are being referred out to the nonprofit community, which is represented by the purple boxes on the right-hand side of your screen. We know that some nonprofits are operating at capacity. They have no more ability to see any more clients, to coordinate any more care. We know that nonprofits exist in a resource-strapped environment. We also know that some have more flexibility and have more space to absorb patients. But there's no publicly available directory. There's no way to really measure where a nonprofit is at that capacity without talking to them one-on-one. And so the percentages you see in these purple boxes are really theoretical to represent that varying capacity. So we want to figure out how to measure that. How do we define that carrying capacity, the full workload that those nonprofits can serve? Because it will look different depending on what need you're addressing, what area you work in, your staffing structure, and the model of care that you are trying to provide. We also know that there are probably dozens more purple boxes out there, and it's hard to know, even if you're really in a well-connected nonprofit community, what that looks like. So we're really trying to see the full spectrum here. And this is an oversimplification. In discussing with our partners, we know that it's more aligned, it's not nearly that streamlined. These are all of the different components. People are being referred to different groups of care. But we really want to know, if we map this system, are there financing tools that we can trigger to better build the nonprofit capacity? Are there nonprofit hospital community benefit dollars that we could use? Are there Medicaid reimbursements for social service delivery that might be able to bolster the community-based partners and able to better serve communities? Because this sector is already stressed as it is, and it continues to operate in a world of resource scarcity. And we wanted to add this additional slide to really show the strength of our community-based partners. As we were discussing this idea yesterday and walking through all of these different slides, Cameron and Kinsey said, well, it is right in theory, but there's some other factors that are going on in the community-based lens of it all when it comes to people that are getting stuck in the system before they ever enter the health system. This example was, we were particularly trying to unpack this idea of the opioid abuse epidemic that is happening and how it's showing up in our communities. And so there are some people that are getting stuck. Kinsey and Cameron told us they're getting stuck between hospital systems. They're getting treatment, they're getting released, but they're never making it to community resources that could really help them reduce this cycle. So we're continually adapting our models and building it out based on what our community partners are seeing going on in the communities that they live and work and are a part of. So in a few minutes, you'll hear more from the Glasser-Schoenbaum Human Services Center in Sarasota, Florida, and Serve Denton in Denton, Texas. These two groups have both been active participants in the nonprofit sector in Nonprofit Centers Network for many years, and have done a lot of work aligning services, trying to increase their own community's access to human services, making their spaces one-stop shops where people in need who might not know what services they need, they know that they can go to these two places and get connected with care. And we also knew that this project was too large as it was conceived. So in our process, we've really narrowed it down. Both of these groups have done needs assessments in their own communities, and we found two commonality issues that they were both dealing with, the opioid epidemic and housing issues, housing insecurity in their communities. So we're going to focus our research in on these two particular issues and map the systems from there. So with that, I'll turn it over to Danielle to talk us through the methods and how the research is taking place.
Great. Thanks so much, Katie. As all of you can probably hear, it's been such a pleasure from the research side to be able to work with these amazing community partners who are all in, obviously, and we were proud today that this is one of our first big things that we're doing together as a team, and so you'll hear from our community partners in a minute as well. I'm going to go through some of our methods, and this slide kind of shows our tasks and timeline, but really I'll just walk through it pretty quick. We've divided our project up into a number of tasks, and so what we said in the proposal was that for our first tasks, we really wanted to look at existing data and literature to get a better sense of the evidence base that already does exist about the role of the nonprofit sector in these social systems. And from that, build out our conceptual framework for this model that we're trying to develop. So how is carrying capacity already measured in different contexts, and what can we borrow from in terms of those references to build our own model? And then we're going to go to the two communities and do interviews with key informants in order to validate that model and try to understand the feasibility of it. So where can we actually get data and to feed into the model? Then we'll actually do the data collection. We're going to grab all that data that we can find and get and do our own survey using our network analysis tool partner, and take all of that data and try to validate and run our model to show how we are measuring carrying capacity in this real-time context. And then at the end, we want to make sure that we're coming back with some dissemination that can demonstrate the complexity pieces of this and how the flows and supply and demand are working through that model. So for task one, we finished it, and so I thought today we'll just do a quick presentation of what we've learned by looking at some secondary data and our systematic literature review. That's all we've gotten through so far since this is research in progress. Some of you might know about this partner data set. For others, I'll spend a minute describing it. Partner is a tool that we actually house here in our center. It is a tool that communities use to run their own social network analysis of their own networks. And so because we've had thousands of communities all over the country and the world use that tool, on the back end we house a really large data set. In fact, I can very confidently say it's the largest whole network data set on interorganizational cross-sector partnerships collected through surveys and from real people, not data mined, that exist. And so we said, let's use that information and try to identify some of these community health networks and try to understand and unpack the role that the nonprofit sector plays in them. So just to explain this, basically there's about 2,000 whole networks in the data set. So each community collects their own data, they include their own partners in the survey, and they answer their own questions about resource contribution, interactions, things like the way they value and perceive one another around those interactions. So what you're seeing there in the top right corner are examples of networks. Those are 12 little ones when we knew who was in the database. Now there's so many that we don't know them all. We pulled a sample of 111 of them that we could identify. It was actually for a different project, but that were focused on community health, public health, and they all included a nonprofit hospital in them. So the little red dots you're seeing on the map are the sample from around the country of that very small sample of the larger 2,000 networks. But in that sample, we have almost 3,000 organizations that we can learn about, and 48,000 plus relationships. So we consider a partnership any two organizations and the relationship between them. So all the data that I'm just going to show you real quick, some results from are generated from those surveys happening out in communities, and what we've done is kind of aggregated them in a way to leverage that information for learning right now. So I love this because when we were going over this with our partners, they were like, oh, is that us? Is that us in Sarasota right there? So it's fun to kind of make it real for people. So one of the first things we just wanted to look at was what are the number of organizations in these kinds of this subsample of networks. And interestingly, in public health, community-based or community health networks, we find that nonprofit organizations are by far the largest sector represented. So about a third of all organizations in these community networks are identified as nonprofit organizations. So immediately what we're trying to surface is the value and the role that nonprofit and public agencies play in these community health networks. We focus a lot on the hospitals, public health systems, and health-based organizations, but these are really a strong presence. So we immediately said, well, who are these nonprofits? So we broke them down and we found out that most of them are health-focused nonprofits or human service organizations, and a little bit of others. But it still gave us some more information about the nonprofit sector in these networks. So a few things we learned here. At the top, you're seeing kind of just bars that show on average number of connections that each of these sector organizations by sector have. You'll see that the local public health agencies and education and research organizations tend to have on average the most number of connections. So what we see is that some of our nonprofit organizations actually don't have as many connections, but there are more of them in total. What you see in the bottom graph there are these scores. So when someone picks a partner in the survey, they get to rate them on a scale of value and trust. If you're familiar with the partner survey, you'll know what I mean by that. But it gives us a sense of the perception that partners have of one another around the value of the partnership and the trust. What you see here, overall trust scores are orange, and you'll see that those are higher across all sector types. So trust is higher than the blue lines, which are perceptions of value. But what we end up seeing is that public health and other health organizations are higher than some of our nonprofit organizations around both trust and value. So even though we're seeing that nonprofits are there's the most amount of those organization types, they're not interacting as much as the other organizations, and they are not perceived as trusted and valued as some of the health-based organizations in the network. And then finally, last thing I'll show you here is we did just run a little regression model to kind of look at some relationships. And what we learned was that private sector, so public and nonprofit agencies report providing more resources to these networks than do private sector agencies, for example. However, private sector agencies receive higher scores on being valued as members of the network. So this kind of stuff is giving us a lot of information about what we really need to tackle, because what we can see is that these nonprofit agencies are playing a very strong role in being present and active in these networks, yet their value is perceived as less than some of the other organizations. And so one of the goals of this project is to figure out how do we surface the value of the nonprofit sector in these networks, and how do we demonstrate that enough to convince the funding mechanisms that come into this system to support the nonprofit sector, to support the system so that it can be high functioning. We're just at the end of this time, so I'll just say this real quick. Task 2, we're building out our conceptual framework. This, you can imagine we're reviewing the literature. We're finding that we need to really think about defining what community is, what is carrying capacity. We're reviewing available outcomes, indicators, and measures to see what's already been validated in the literature so that we can make sure to include those in our model. And we just are going through a process of figuring out what is ideal and what's feasible and realistic to include in this. And then what we're doing is, this is kind of our draft first go at what our conceptual framework could look like, including measures of things like the community characteristics, supply and demand factors, physical organizational attributes, and also fiscal attributes of both the organizations and the system. We think what we're going to be able to contribute that's different from any of the literature out there on carrying capacity are measures of collaborative nature, measures of partnerships. When we administer the partner tool, we're going to use the indicators from that as part of the model to see if we can indicate levels of carrying capacity for these communities. And so our next steps are just to complete the model, to conduct our interviews, and collect all the data to feed it in there. So we will very much look forward to what we're going to be able to present when we're not necessarily as much in progress, but more towards an end. So with that, I'm going to go ahead and I'm not sure if I'm to do this or Karen, Anna, but our community partners are going to present next and also provide the commentary at this point.
Thanks so much, Danielle, and thank you, Katie. So since we're starting with, looks like the Glasser-Schoenbaum Human Services Center, I'm going to hand the mic over to Dr. Cameron Hodgins.
Good morning, everybody, or good afternoon, depending on where you are. It is an honor and a privilege to be a part of this project, and we have just had a great time working with Danielle and the team here. Just so that you understand a little bit about the Glasser-Schoenbaum Human Services Center, we are a kind of a one-stop shop of human services here in Sarasota County, which is about 60 miles south of Tampa, so we're on the southwest coast of Florida. And for those of you on the call who have been to Sarasota, I like to call it a tale of two cities. We are sort of known for retiree central. We have one of the oldest population demographics in the country. We have beautiful beaches, ranked #1 by lots of beach ranked people. So we attract a lot of tourism and a lot of destination location folks. And so for people visiting, it looks very pretty and shiny, and lots of restaurants and those kinds of things. However, we have a population who are struggling to afford housing here. Wages have not kept up with the cost of housing like many parts of the country, and also in has crept opioids and the problems of addiction. So this campus is 28 years old. We house today 16 organizations. We're going to welcome a 17th next month. And this slide right here just gives you an overview of who's here. And I'm not going to go through them one by one, but I just want you to understand that it's kind of services provided from birth to what we say earth. So we have everything from prenatal care for pregnant mommies to AARP and senior employment, and sort of a little bit of everything in between. We are unique. We are the only one like it in the west coast of Florida. Charlotte County, which is a little bit south to us, is going to open one in the next couple years. Jacksonville has a center too, but it's more administrative offices of nonprofits. We actually do direct services out of this location. The next slide, just so that you kind of understand the breadth and scope of what we do. I did mention some of this earlier. We have 17 agencies. There are 14 buildings here. We have 5 acres, and we're on one campus. I mentioned Sarasota County, but our circuit system, so our judicial system, works in a tri-county region of Sarasota, Manatee, and DeSoto. So a lot of the providers on the campus have referrals from 3 counties. We've had 56 agencies here. We have about 48,000 square feet of air-conditioned office space. In 2016, we know we served about 45,500 individuals. The reason that the nonprofits want to be here is that next bullet point. We only charge $8.50 a square foot a year. All other maintenance and CAM costs are included. The only thing that they pay for is phone and internet. Over the time that we've been here, we think because of our business model, we've saved the agencies about $15 million in overhead. In just 2016, the budgets on the campus came to a total of $16.9 million of services delivered in 92 programs. And you can see how many staff we have here on the campus day in, day out, how many volunteers were mobilized, and we save about $500,000 to the organizations here annually. I'd like to say that our scope is broad, our net is large, and this kind of project that Dr. Varda is doing is really a good fit for who we are in our community and who we serve. I think I'm done, unless there are questions.
All right, if folks are having questions, please go ahead and enter those in the chat box. Thank you, Dr. Hodgins. I believe we'll now hear from Kinsey Adamson at Serve Denton.
Well, hi, everyone. Like she said, my name is Kinsey Adamson, and I have the privilege of serving as the Operations Assistant with Serve Denton. So kind of just to give you an overview of who we are, Serve Denton is a 501c3 community-based organization that supports nonprofits that open doors for people to become self-sufficient. And we kind of do this operating out of 2 locations. So we currently own and operate 2 different properties. One is called the Wheeler House, and the Wheeler House is a transitional housing facility for moms and their kids. And it's currently managed by Giving Hope and Health Services of North Texas, 2 of our partner agencies here in town. We opened that property back in July of 2015, and since that time we have served about 79 moms and their kids coming in and out of our transitional housing.
Kenzie, I believe we've lost audio on you.
Me?
You're breaking up. Are you by any chance on speakerphone?
Yes. Let me try taking that off. Can you hear me better?
Yes. Thank you.
Okay. All right. Is that better sound for you?
That's terrific. Thank you.
Wonderful. Were you able to hear anything, or should I kind of recap a little bit?
I think we were able to hear up to the beginning of the Wheeler House, I believe, so please.
Wonderful, wonderful. Okay, so the Wheeler House is a transitional housing facility for moms and their kids, and it's managed by Giving Hope and Health Services of North, 2 of our partner agencies here in town. The property opened back in July 2015, and since that time it has been able to serve 79 moms and their kids, as well as over 1,600 different patients. So that is the Wheeler House. We also have a second property, the Serve Denton Center, which is a 32,500 square foot building that can accommodate multiple nonprofit agencies in one convenient location at an affordable price. So those in need only have to visit one location to receive the help that they are looking for. We are currently under construction at this project. It will be approximately a 5-phase project, and we are currently just wrapping up phase 1, hoping to move in the next few weeks and have our partner agencies up and running by the 1st of April. So our vision for Serve Denton, we have a couple different things. We strive to be a one-stop shop for social services. Kind of our hope there is to create opportunities for people to become self-sufficient by providing access, again, in one location. So people don't have to travel all over town and seek out different people. They can come to one place and get the help that they need. And in hopes also by doing that, we would improve collaboration amongst the nonprofit agencies themselves. And we feel when collaboration is happening amongst the nonprofit agencies, that and in turn better serves the client, and they are able to have a better general well-being. If you see that document or the picture off to the right, that is our ladder of self-sufficiency, and that's kind of what we use at Serve Denton to kind of evaluate what are the needs in the community and what are our current partner agencies, and where are our gaps. And so we are hoping to fill all 19 of these rungs, and you can think of it in terms of a general ladder. So when you use the ladder, you're going to start at the bottom and you're going to work your way up to the top, and it's important to have a firm foundation below you before you get on the ladder. So at the bottom, you'll see things such as food and clothing and these major needs in our community, and kind of working our way up. As we move along in the phases of our building, we are excited to bring aboard some new agencies who are going to fill some of these major needs for us. So that is a little look at who we are as an organization, and then I'll give you a quick overview of what our community is looking like. So Serve Denton is looking forward to participating in this project because it will allow us to address 2 major needs in our community: homelessness and addiction. And these, like it was clear, are going to be addressing as a project. And we've seen that homelessness and addiction often go hand in hand. And so according to our United Way needs assessment back in 2017, 228 people experience homelessness on any given day in our community. And so that's kind of the reality of what we are working with here. If you'll see at the top right-hand corner of your screen, there is a diagram that kind of shows us the different of what the causes of homelessness are and some of the needs for homelessness, and kind of the way those kind of relate to one another. And the diagram right below that just kind of points out in more detail what it does. So some highlights of what major causes of homelessness are in our community. We are seeing unemployment, people not being able to pay rent, untreated health-related issues, and then just a general lack of people are struggling with and are leading as causes for homelessness. And we also see that a major one as being addiction. And so kind of on the other side, just seeing those needs that relate to each of these causes. So transportation, unemployment, people can't get lose their job. And so we're excited at the Serve Denton Center to be not only located on a bus route, but also be in a part of the city that sees about 29,000 cars pass our building in one given day. And so just being located in a feasible place for people to be able to come. Also seeing, job skills and opportunities relating directly to not being able to pay rent and keep your job. So we're looking forward to, at the Serve Denton Center, having a job board where all of our partner agencies are able to post on this job board, and when clients walk in, we have a wealth of information. So it's not just one agency, but it's a whole community of agencies to provide information for our clients to get them back up on their feet. Moving down the list, looking at the untreated health issues, and a direct relation of that need is case management. So, being able to work better with our health service providers and bridging that gap so that we can get people in our doors to treat those health-related issues. We're excited to have a affordable health clinic on our property, which will allow us to make needed referrals. So, if someone comes in and they are struggling with an addiction, we can get them the help they need, but maybe also send them down the hall to receive some counseling services to kind of need the deeper need that might be going on for them. At the lack of support that they might receive, and that could be directly to food and clothing and some of those other major needs listed at the bottom of our ladder and even all the way up to the top of just needs. You'll see lastly that diagram in the bottom left-hand corner of your screen. It's a separate survey that was taken, but it shows the same needs are coming up. So people are needing affordable medical care. They're needing housing. They're needing child care. And all of these are relating together. If you don't have affordable child care, you might not be able to maintain just having a place where people can come in and receive the holistic help that they need. And so we're excited to be working on this project and hope that it will give us a better snapshot of how our current system is working, so then we can better bridge the gap between all of our nonprofit agencies, between nonprofits and health services, so that when people come in from point A to point B, we can get them in and get them out the door, hopefully into a life of self-sufficiency on their own, and so they don't get lost in that system that we're seeing.
Thank you, Kinsey, and we do apologize for the audio issues with that call. I think we just have a bad connection, so hopefully folks were able to hear most of Kinsey's comments. We're going to move to the question and answer portion of the call now. If you have questions, do please enter them in the chat box in the bottom left corner. One of the first questions we had was related to the timeline for the project, and I know Dr. Varda and Katie covered this in their part of the presentation, so I've just moved back to that slide so you can again see the timeline for those dissemination activities. I wonder if the team at Colorado would like to say anything else about those dissemination activities that are planned.
Yeah, and we have it on here as summer 2019, as though we will spend 2 years doing work and then show something at the end, but we don't. That's not our intention at all. We'll be participating in all kinds of ways that we can work dissemination into the project as we go forward. So for example, I showed task 1, and we actually have a paper under review. We've submitted our R&R for it. So hopefully that'll come out as a paper soon, but we've also already presented at several conferences, and we'll do that. But we're also working with our communities on doing visits with them in person, and during those visits we plan to meet with the community partners and not only share with them what we're learning, but also then learn back from them so that we can continue to build out the project as we go along. So certainly by the end of the project, we hope to have something that's pretty public and in a format that we hope other communities can test and model themselves as we try to build out this. As we didn't promise to build a tool. If you know me, I love building tools, and so I'm like at risk of building too many tools. And for this particular project, we didn't say that the end product is a tool, but we do plan it to be a model that we can hopefully translate into a tool that can be something that communities can grab and use.
Thanks so much. And I would also point out from the program office side that we do try to keep the projects updated, the projects that are funded through Systems for Action, on the website. So as presentations become available, as publications come out, any reports or other kinds of briefs that might be issued by the project team, we will make sure to provide links to, or in some cases PDFs of, these kinds of materials on the website. We also, with the Research in Progress webinar series that we thank you for attending today, we also try to check in with the researchers at least a couple of times during their project. So this launch call where Dr. Varda and her team are really describing the work that's getting ready to be undertaken and has already begun in many ways. We'll be checking in with them a little bit later on to hear about how the work is coming along and what they're finding. So there will be many opportunities to hear back from this team on how the work is progressing, and we hope that you'll check the website frequently and attend the webinars to hear more about this as it moves forward. I'm going to just ask the team a question right now, and I'd like, if we can, to hear from all four of our speakers today. With Systems for Action, when you're looking at alignment strategies across multiple systems, it's really key to have perspectives from all of those systems, practitioner perspectives in addition to researchers who are skilled in working with those systems, at the table to define the problems, think about what the research questions are, think about what the best ways to answer those questions are. And this team has done a really good job of engaging in that work very early. But for Systems for Action, we actually require stakeholder engagement as a component of the research that is funded through this program. So for those who are just thinking about questions that they're kind of interested in answering, maybe they're community partners who really want an answer to how to better align their work with other systems and other sectors, or maybe they're researchers who have some tools that they'd like to bring to the table to do that. Perhaps our speakers can each say a little something about how you have started establishing those kinds of stakeholder relationships. You are really at the CBPR end of that spectrum. We just require some level of stakeholder engagement, which could be, community engaged research, or could be CBPR that is more led by the community or the community practice. So if our speakers wouldn't mind just saying a few words about how you worked on building those partnerships and building that trust that is so pivotal to this kind of work. Maybe start with Katie and Danielle.
Excellent. This is Katie. We are, because of the model of the Nonprofit Centers Network, we live and breathe participation in all of our work, and we start with looking at who is there, and we are always engaging with our members in these realms on a daily and weekly basis. So when this idea came up, it was a call to our community to see who might have a lead as to a system that it is working in this way. So that is where we identified Serve Denton and the Glasser Schoenbaum Center. But we have other members in other communities across the U.S. and Canada who are really eager to see how this model is developed and are asking me how we can already start replicating this in other ways. So we try to maintain those local relationships. As a national organization, it can be a challenge, but we are all committed to really innovating in ways that are meeting our missions on a grander scale. So, I don't have the same kind of local ties as you're going to hear from Kinsey and Cameron, but there's so much community demand for this research and where it's going to go. I have to tell people that it's going to take some time for us to build out these models and figure out how we can test it in more communities.
I guess I'll just add, I love your question, Kara, because it actually lets us, I think, reflect a little bit on the story that Katie started telling when she started her presentation. But just to kind of bring it back even one level, I'll say really proudly, like, our center has a mission to build capacity in communities, and that's a core mission of our research center. And so with the first grant we ever got from the Robert Wood Johnson Foundation to build the partner tool, we kept that as our core mission and modeled the whole development of that tool with this kind of approach where we highly, highly value that we have skills and expertise and methodologies that we can bring to bear, but we're really without the community involvement and the community feedback in that work that we don't really have the full picture. And we've believed that since day one. And I've actually had the privilege of working with such a really strong research team that has roots based in community-based organizations. Almost all of our team, including myself, are AmeriCorps alumni, and we're proud of that. We're proud that we've spent some time actually, on the ground working with communities and been able to translate that into our research practices. And so we just kind of try to start every project with the community in mind, and we usually meet together. And one of the first things we say to the community is, we don't want to devalue what we're bringing at all. We think we're bringing good stuff, but really without the community, we're not. We don't feel like we're, at our best to do that work. So with that kind of value system in mind, we take a research approach to all of our work. And then just lastly, I was trying to recall our first meetings when there was even actually someone else working at the Nonprofit Centers Network as well. And we had a couple of meetings literally where we kind of looked at each other across the table and said, well, you guys do super cool stuff, and you guys do super cool stuff. Like, is there anything super cool we could do together? Like, it was literally just sitting down, and we went to their office. I think researchers need to get out of their space and get into the community offices, and really just started to outline, like, what are the problems that the questions you're trying to answer in research, and then us asking the community, what are the kinds of questions you're trying to answer right now, and is there a way we can help support that? And we went through a few ideas until we finally said, you know what, this is the one that really is resonating for all of us. And then when Katie said, let us put our requests out to our network to see if there are community organizations that want to participate in this inquisitive journey with us, then so it really evolved that way. And so I think it takes a number of different things, and I guess actually this is the very last, this is kind of a favorite topic of mine. This is the last thing I will say on this is this is really hard, time-consuming work to take this approach. So I'm not going to act like it's all just good. We could, as researchers, easily sit at our desks and send out surveys and analyze them. My center is sitting on an enormous mountain of data, and literally I could probably never do another project and write papers for the next 10 years. And that would be one way to do things. But so when we engage with the community, we have to spend a lot of time. We do not work on a semester schedule. We don't take spring break off because it's time if our community partners need us to work during that time. We literally work on a community schedule. And that makes a huge difference, I think, in being able to meet them where they are at rather than expecting them to work around our kind of funky academic lives. And so it just takes a lot more work to do this and a lot more time. And so I think if you have a heart for it and you're all in, then it's going to work. So
let's start over to Cameron. What are your thoughts on this community engagement question?
It's interesting because one thing I said, Sarasota is a tale of two cities. We have multiple family foundations and large community foundations here, and 4 or 5 of them that have almost $1 billion in managed assets. And one of the things that they're looking for all the time in investing in human services is where are the gaps, where are the overlaps. I actually see that that's a question here too. And kind of transitioning what I would call a good old boys giving network that used to exist here into something that's more sophisticated and data-driven by what our needs are, and helping donors find impactful giving. And I think there's an issue in our community of where's that data coming from? How are we mapping it? How are we looking at the gaps? How is healthcare functioning here? We are blessed also to have a really strong nonprofit hospital here that in Sarasota County that really drives a lot of funding decisions and research as well. And partnerships with them literally have just been like, I know the CEO. We hang out at an event together. I know his daughter. He knows my family. And that's kind of how I've made just personal relationships with these folks. We're also, the campus is situated in a community in our town called Newtown, which is a historically black population here, and it's been that way for years. And the large hospital, Sarasota Memorial, just opened a specialty clinic in the Newtown community. And we've made a partnership with them just as kind of a social services referral site because their building opened without case managers there, and literally the physicians were calling me saying, Cameron, I just had a client walk in a domestic violence situation. Who do I call? Of course, this is not something that they're knowledgeable about necessarily without their social work team there. So that's how we have built our relationships, literally just kind of being at community events, talking to big funders in town, talking to family foundations, helping support our agency nonprofits here on the campus and initiatives that they're doing, sharing stories. I mean, I was telling somebody yesterday, we host 4 luncheons here a year just for the agencies on the campus, just to have an informal way to talk to each other and then start, promoting what works we're doing, who's got new grant funds. But I think in our community in particular, there needs to be a better alignment of all the wealth that's here, the private wealth that's here, and where it's being channeled to make the most impact.
Kenzie, would you have anything to add?
So I agree with Cameron, kind of the same idea happening at Serve Denton. It's really just a matter of networking and building your community around you and, getting out in the community and going to events like she mentioned and just meeting these people and establishing a relationship with them, going to their events, inviting them to your events. And I think also just being involved in a construction project and an idea and a phase that's coming to be and coming to fruition is exciting for people to see the possibilities of what isn't here and what could be here and what will be here. So I think it's an exciting time for people to be involved. And we've been just at the start of this project have just been reaching out and have already had these initial meetings with some services in town of bringing them out to our property, going and visiting their offices, letting them see what this will become so that, we can better partner in the So far, all of our meetings have gone really well, and they're all excited about partnering. They all see the same issues, if you will, or gaps, if you will, that we do, and they're excited to work with us to kind of bridge those.
Terrific. Well, unfortunately, I see our time is up, and we do have a few questions in the queue, so I do apologize to those of you whose questions we did not quite get to. I invite you to learn more about this project on the Systems for Action website. Perhaps contact the investigators directly, and to join us for our upcoming webinars. Well, let's see what happened here. We jumped way back. We'd like you to join us for our upcoming webinars in the coming months. In February, we'll be looking at more new projects from this most recent call for proposals. So I want to thank again our excellent speakers today, Dr. Danielle Varda and Ms. Katie Edwards, as well as our commentary providers, Dr. Cameron Hodgins and Kenzie Adamson. It's been a pleasure to hear from all of you about this exciting work. We look forward to keeping up with you as it moves forward. Thanks to everyone for attending, and we'll be in touch soon. Looking forward to hear from you all soon.